Hi, it's Abdul Mumit again, and this is my up-to-date of my video blog of my distal bicep tendon rehab. Just a quick video of the type of exercise I'm doing for my elbow, and as I mentioned before earlier in my other videos, I'm using this TheraBand, and the type of TheraBand I'm using is the lightest one. I use the lightest strength or resistance wise tends to be red colour, but you could go up to very heavy resistance bands, and these tend to be about grey or black colour. Well, I'll show you some of the exercises I've been doing with my elbow. But first of all, as I mentioned before, the bicep brachii flexes and bends the elbow. So the type of exercise I've been doing, using this resistance, flexion and supination at the same time, as you can see. So I'm using the band as a resistance. And at the same time, like I said, the elbow has two other muscles, altogether three muscles that bends the elbow. I'm going to do other two muscles as well, because these have become quite weakened as well because of lack of activity. So I'm going to focus on my brachioradialis as well, which will be good for the form as well. Basically the brachioradialis comes from all the way from here to your radial tuberosity. And once again, it bends the elbow as well. You might feel a bit in your forearm. Okay. And the next exercise is I'm going to work on the brachialis muscle, and that's the main flexor of the elbow. And by doing that, I have my hand supinated, and from here, I flex against the resistance band. Okay. So these are the type of exercises I'm doing for the elbow. And in addition to that, I'm also doing resistance exercise for my wrist as well. Like I mentioned in my previous video, the wrist tends to become weakened and tends to be a lot of pain there as well, which previous people have seen in YouTube experience as well. So I'm going to do some strengthening exercise in my wrist, and I'm going to do like so. So the key thing is to have that all stable, and you're just going to move your wrist. So from here, against the TheraBand resistance, I'm moving my wrist. So I'm extending my wrist. Okay? And now from here, I'm going to flex my wrist. The key thing is to have this really tight like so, and flex against resistance. And it will be a bit difficult. And the other exercise as well. So from here, from pronation position, I'm going to supinate my elbow using the TheraBand as a resistance. Okay, and from supination, so as you can see, I'm using my fingers to give it a bit more resistance, and pronate. Okay, so, and also another one, a good one, is like so. So I'm working on my forearms as well, in addition to my elbow. I'm not only focusing on my flexor muscles as well, I'm focusing on my extension muscles as well, as in like my tricep. So hands behind back, and from here what I'm just doing, straightening my elbow. So I'm working my tricep like so. Okay, there's other tricep exercise you could do. So any exercise against extension of the resistance, go focus on your extender muscles, which is your tricep muscles. And also I'm going to demonstrate something first. Today's going to be my first day doing push-up after my distal bicep tendon surgery. So I'm going to demonstrate first on YouTube today. I won't be able to do much, but today's my first day, so I'm just slowly trying to get used to the movement. Okay. Down and up. Let's do about 10 I say. about 10 I think. So it was my first day doing push-ups, and it's good. It's good to, you know, doing push-ups again. And these are only some of the exercises that I demonstrated, and I'll demonstrate even more exercises. But according to the exercise I'm doing, it's just for the rehab side of things. And in the future blog, I'll be doing exercises as well to lose weight. As you've probably seen, I gained a bit of weight because the lack of inactivity and eating quite a lot of, you know, the way I've been eating when I do physical exercise. So in the future blog, I'll demonstrate the rehab exercises, therapeutic exercises, and also exercises to lose weight. And hopefully this should be all gone. Okay, thank you. Keep you up to date. Take care.